This is the Sommer Klag Advocacy Awards, Impact Awards. It is an honor to be up here. I'm Shelley Hearn, a professor here at the school, but also I had the honor of being the director of the Lerner Center for Public Health Advocacy. I want to give a special shout out, and I'm really glad that they're not in hearing range, a special shout out to our watch party that's in another room. They're so rowdy, and so many of them, we had to give them food and keep it, keep it in a separate place. Wait, I think I can hear them. I think I can. So thank you, everyone. And I know there are over 100 people online who are watching and engaged in this. And as part, this awards process is something that is really near and dear to the hearts, not just of the Lerner Center, but of the entire leadership at the school. We celebrate advocacy here at Hopkins. It is an anchor in our strategic plan and really the heart and ethics of what we do. We're incredible researchers. We are incredible generators of evidence, celebrating lived and learned experiences. But we absolutely know that if we don't take that knowledge and embed it and involve it with the policymakers and the people who are making decisions about our health, then that evidence doesn't get heard and it doesn't matter. So I can't thank enough the 5 finalists, fabulous faculty that we have here at Hopkins, who are embodying that type of work. And it's a little hard because this award gives $40,000 to 2 of the finalists, or 2 of our 5 speakers today. I wish it was to everyone. We'll keep doing this, but I have to give a particular thanks to Sid and Helene Lerner, who made this award possible. In part, they recognized and have been watching public health for years and years, and know that if you don't incentivize, if you don't bring life, attention, and visibility to this type of work, then it gets forgotten in the academy. And that's why we are doing this award. Enormous thank you to our faculty members who are brave, who are proud to come up here and do this lightning pitch. So let me give a little bit of the details in terms of the overview of the award. Amber Ray, if I could get that slide so that everyone else can see what the pitch competition is all about. So we have each of our finalists will come up here and have 7 minutes to pitch to all of us on what is it that they want to champion? What is the advocacy cause? And we'll take a look at and want to hear what's the impact they're going to have, why their work will matter, what they can be doing to help push and advance these efforts. The judges, who we will get to introduce, and I'm not allowed to introduce them because I get over-enthusiastic because they are so extraordinary. But those judges are going to have 3 minutes, and watch out, finalists. Those judges are going to give you a series of questions to really kind of unpack what it is you're thinking about and why it matters. So the judges are going to score the presentations, but it's not TV, but this is reality. The audience, and we're not giving special favor to the watch group, it's the entire audience also gets to vote online to give a voice to what they heard and what they think matters too. So in the academy, we can have a democracy, kind of. So the winners will get announced at the end of this event, and you'll get to know where folks are going. Now, I want to bring up to the stage the Diane Caraggio. She's the chief of staff of the Lerner Center, and she and this incredible team at the Lerner Center who have put on this event will walk us through some of the specific details. So Diane, drum roll, here you go.
Thank you, Shelley. Thank you. I'm Diane Caraggio. I'm the Chief of Staff for the Lerner Center for Public Health Advocacy. I'm actually, before I talk about our judges, I would like for us to tune in for some remarks from Dean Emeritus Al Sommer. We want to thank him and acknowledge him for his leadership in public health advocacy. And we'll hear a few words from him, and then we'll come back and I will introduce our judges.
I'm Al Sommer, a former dean of the Johns Hopkins Bloomberg School of Public Health. Thank you for joining as we highlight the exceptional advocacy work of our faculty at the Bloomberg School. My warmest congratulations to finalists of the Sommer Klag Advocacy Impact Awards. Your work is critical to ensuring that important public health policies and discoveries educate policymakers and the public and change beliefs and practices. Many thanks to the Lerner Center for creating this opportunity to heighten public health advocacy and impact. I know from firsthand experience that advocacy is essential to making a strong, lasting impact on the health of our communities. Policy turns discovery into practice. Continue engaging in advocacy. It's a core pillar of public health. Whether that means changing behavior, policies, or laws, discoveries ignored are discoveries that have never been made. I hope you'll find these pitch presentations engaging and inspiring. I look forward to joining the Lerner Center and celebrating today's award winners.
Great. Thank you, Al, for your remarks and for your participation in this exciting award. So I want to introduce our judging panel and just say that choosing the finalists is really exciting, but the next most exciting thing about this is choosing the judges. So we want to thank them for being here with us. We've chosen them because they each come with diverse expertise in policy and practice, and they are all well-respected colleagues in their area of specialization. And this year, we have student representation, which we're really excited about. So we have Vanya Jones, we have Jenna Roman, we have Katrina Forrest, and Michelle Spencer. So thank you all for being here. We're very excited to have you. So thank you all for coming. We're going to get started, and we will introduce our first pitch presenter. First, we have Katie Nelson. Katie Nelson is an assistant scientist in the Department of International Health. Katie will be presenting on dog-related policies for the Navajo Nation. According to Katie and her team, dogs and humans have had unshakable sacred bonds for millennia. Colonization disrupted these relationships for indigenous people, which directly contributed to increased violence, zoonotic disease transmission, and economic hardship in many communities. Katie's Navajo Nation-based team believes in the magic of the human-dog bond and recognizes the need for restoration. So they're linking arms and paws with community members, partners, and tribal leaders to translate evidence into policy and action. Welcome, Katie.
So much for that introduction. My name is Katie Nelson, and I'm so grateful to be joining you all today as a guest on the unceded homelands of the Piscataway and Susquehannock peoples, or what is now referred to as Baltimore, Maryland. I want to take a second to thank the Lerner Center for hosting this event, our esteemed judges, my fellow presenters, and everyone who's tuning in online and joining us for this event today. Dogs have had an role in society since time immemorial. They are workers, they are protectors, they teach our young people a sense of responsibility, and that bond between people and their dogs is irreplaceable. Studies show decreases in stress, anxiety, increases in overall well-being, and really just irreplaceable. The issue is that colonization has disrupted this bond for indigenous people and their dogs. And we've seen the consequences of this in recent years. There have been an increase in prevalence of dog bites, attacks, maulings on the Navajo Nation, and we know that this issue is not isolated just to these specific communities. However, this has caused an increased concern among community members for their overall safety and well-being. Parallel, we've also seen an increase in the prevalence of Rocky Mountain spotted fever cases in the southwest region of the US. This is a tick-borne disease that causes serious illness in humans. Free-roaming dogs tend to carry ticks on them, which can then be transferred to humans and cause illness. These compounding factors, which have been exponentiated since the COVID-19 pandemic, have really instituted a welcome shift among leaders on the Navajo Nation to get back to this, that bond between Dene people and their dogs, and that makes this an astute time for us to tackle this issue together. This is a newspaper article from a press conference that was held earlier in April of this year. Dr. Andy Nez is the Navajo Nation delegate for Upper District 18, and here he shares his vision for amending Title 14 and 17 to the Navajo Nation Code. He has been a persistent champion in this effort and our primary partner. Dr. Kelly Upshaw, a member of our Community Advisory Board, and her team were also present at the press conference where they really underscored the link between dogs and people. Why does this matter for us as humans? There are approximately 500,000 free-roaming dogs and cats, but we're focusing on dogs for today. And so really to get a handle on this issue, we need to work together, which is where our team from the Center for Indigenous Health comes in. We have a long-standing relationship with the Navajo Nation. And so we were approached in 2024 by Dr. Nez and his team and asked to be part of a legislative task force to really strategize around what can we do to get a handle on this challenge. And that is where the Positive Change study was born. Over the last year and a half, our team, who's tuned in today and pictured here on the bottom, has been very busy. We have since completed our first aim of 3, which was part of the Positive Change study that we contributed to this legislative task force, where we really see our role as helping to gather the evidence needed to translate into policy. So pictured here, we have 2 of our staff presenting to the animal control team. And we have been busy out in community talking with people, really uncovering what are their lived experiences, what are the barriers that they're facing, and what are the solutions that they see to this problem, because we know that solutions lie in community. And our role is really to uncover that and help make that a reality. And part of that has also been building relationships. This is a new area of work for our center that has been working with the Navajo Nation for over 30 years now. And so part of our job has really been building relationships, learning who's doing work in this space, trying to break silos where we can. One of our big supporters and partners that I want to emphasize is the Best Friends Animal Society. And we're trying to understand and really align ourselves with their mission, which is to save them all. They've been doing work on the Navajo Nation for decades. And so we are, like Diane shared, we are linking arms to try and figure out how we can really further our impact together. So our action plan, the first 2 steps, are part of that 3-aim proposal that I mentioned. The first step is to conduct a cross-sectional survey of 200 residents from the Upper District 18. We're starting with Dr. Andy Nez's district, as he's our champion. And we want to know what are people's perspectives around the acceptability of some of the proposals that we're wanting to make to these titles in the Navajo Nation Code. So for example, we want to know, how do people feel about the prospect of increasing the limit in the number of animals that people can actually have in their household? How do people feel about the prospect of implementing a foster program on Navajo Nation so we can be maneuvering animals around without having to rely on rescues in border towns? Questions like this. Action step number 2 is to take our survey data and our qualitative interview data that we've just completed and put that all together into a cohesive policy proposal that Dr. Nez can then take and move forward to the Navajo Nation Council. And our last step is really to support Best Friends' vision in reopening 2 veterinary clinics that have been sitting empty for the last 5 years. This map shows Fort Defiance, where our team is based. These 2 X's indicate where those vet clinics are located in Chinle and Shiprock. This process entails on-the-ground support. We need to be getting buy-in. We need to talk with people so that they understand the impact that opening these clinics up could have. We've got the finances, we've got the staff. We just need their support so that they understand the long-term benefit of having these clinics reopened. And that starts with getting support letters from other agencies in the area, presenting to the agency councils, and getting that tribal resolution passed in both of those locations so that we can move this forward. This is our vision. This is the long-term impact. We want to get to this, and we know that public health advocacy doesn't happen overnight. This is a marathon. This is a long-term game, but we want to see a future where people feel safe in their communities. We want our animals, our dogs, to feel loved, well cared for, and that they are safe too. And that starts with getting this evidence moved forward into policy. And also, we take very seriously our success in measuring not only the deliverables that are going to come from this, because yes, there are those, but also the deep, trusting relationships that we have been working on over the last couple years and will continue to with our partners in the community. So with that, I want to leave you with this quote: "Res dogs are the storytellers of the land. They carry the same spirit of endurance, loyalty, and love that runs through the people." Thank you very much.
Thank you, Katie. Thank you. You can hop off and hand the clicker to the next. Oh, I'm sorry. I'm so sorry to everyone. We have questions. We have time for questions. We'll take our first question. I think it's Michelle.
Thank you, Katie.
Yeah.
What a fantastic presentation. I so much appreciate your introducing this to us. Can you tell me how you will ensure you achieve balanced perspectives on the issues being posed in the survey?
Yeah, thanks for the question. And I don't know if people online can hear what's being asked, but the question was around how do we make sure that we have an unbiased sample in terms of the survey. So we have worked diligently. We have partnerships with the police department, with animal control, with housing, with a number of different agencies that work within the Navajo Nation government, and really thinking strategically about how we can sort of stratify our sampling across communities, because we don't want to just hear from the animal lovers out there like me. We want to know people who might be against this issue, because we know that that's a reality. We want to hear from people who have been the victim of a dog bite or attack. So we're working diligently with our partners to really leverage the relationships that we have in the community to get access to those people using those trusted relationships. So there's sort of a warm handoff, because we know that this can be sort of a stigmatizing topic to talk about.
Thanks, Katie. I think we have time for one more question.
Katie, thank you so much for your presentation.
You're welcome.
I'm curious, what do you foresee the impact of policy revisions having on many of the local agencies that you're working with?
Yeah, that's a great question. We have not heard once in the last year and a half that we've been tackling this. There is so much gratitude that this has become a priority at the forefront of leaders and of people in the community just talking about this issue. It's unfortunate that it's come to this scale where there's been loss of life. But the agencies that are on the ground doing this work every day, they need this higher level structural change to happen so that, like I said, in the event that an animal is taken into animal control, there's more accountability across agencies and partners and other people working in the community, that these animals can be moved around in a safe way so that we're not having to resort to euthanasia. We're not having to resort on calling these rescues that are off the tribal lands last minute to try and see if we can get a spot. So really, these policy revisions will make everyone's jobs so much easier, and I think in turn will have a long-term impact on their overall well-being and levels of burnout that we also see as being a sort of a secondary problem as part of this challenge.
Thank you, Katie. And thank you, Katie, for being the guinea pig. I know there was a few little technical difficulties and I forgot that there were questions. So I think we're good now. So I will introduce our second presenter. Up next, we have Mariana Socal. Mariana Socal is an associate professor in the Department of Health Policy and Management. Mariana will be presenting on protecting the U.S. pharmaceutical supply. Supply disruptions can cause prescription drug shortages, leading to poorer health outcomes and higher healthcare costs. The Johns Hopkins Prescription Drug Supply Chain Data Dashboard, a first of its kind, publicly available comprehensive database, can help improve the U.S. pharmaceutical supply through data and evidence. Mariana believes disseminating the Hopkins dashboard can help policymakers identify priority drugs for initiatives such as Made in America policies, help hospitals purchase higher quality drugs, and empower providers and consumers to make better therapeutic choices, bringing information to the palm of one's hand. Welcome, Mariana.
Thank you so much, everyone, and special thanks to the Lerner Center for this opportunity. I do think that today's conversation really reflects the breadth and width of what we do here at Hopkins. And my contribution to advocacy today, it's about the drug supply. So prescription drug shortages, they are a frequent problem in the US, unfortunately. In 2024 alone, we had over 300 drugs in shortage, and shortages are lasting long, sometimes several years. We haven't found good solutions to this problem. Consequences when a drug is unavailable, so a shortage is when the volume that gets manufactured is not sufficient to really meet the needs at the hospital level, at the pharmacy level, and so on. When there is a lack of supply, patients suffer because they don't have the medication. They get maybe suboptimal treatment choices or delayed treatment or get less of quantity of the drug they needed. And so they get poorer outcomes from a clinical perspective. But also from our healthcare system perspective, we have higher costs. We have burden on providers from having to find alternatives and maybe higher cost alternatives as well. There is a strong bipartisan consensus in Congress and in the federal administration that this is a very big issue, and it's a top policy priority. Now, the question is what to do about it. Last year alone, in the last congressional session alone, there were over 30 bills introduced that relate to this. But there's no consensus as where we should even start. And so a big gap in finding this consensus is a lack of information. We don't really even know where our drugs come from. There is a high dependency on other countries. We depend, my research has shown that we depend on over 100 countries just to our supply of antibiotics we have historically depended on. So we depend on this global network of suppliers, and the federal administration is supportive of initiatives to galvanize our pharmaceutical supply, including things like Made in America, for example. But the question is, how can we even help policymakers identify which drugs to prioritize? How can we know what is really made in America? How can we track if a drug is made here, but maybe with foreign components and the dependency is lying upstream in the supply chain? Well, that's what we care about in this project. And I'm just showing you how the issue has this enormous attention right now. So we have, for example, a recent report from Senate Committee on Homeland Security, looking at it from a national security perspective. We have the White House announcing they really want to incentivize domestic manufacturing. We have the media research, and we have, academia also in this, but a really serious problem of lack of data. So that's the groundwork that we at Hopkins have done. Imagine you have $100,000. If you do have that, you can easily buy this data in the commercial market. There are commercial entities that they collect information from global manufacturers and they sell that information. And we at Hopkins have done that. We have published using this data. But we believe that this is a too high bar, too high of a challenge to allow policymakers to identify the right information. So what did we do? Well, with funding from Hopkins, initially from the Nexus Research Award, we got it in 2023 and to the 2024 cycle. And we assembled a multidisciplinary team of faculty here at Hopkins, including from the Johns Hopkins Bloomberg School of Public Health, the Carey Business School, the School of Medicine, the Advanced Physics Lab, and the Engineering School. And we took the best minds and we created the Johns Hopkins Prescription Drug Supply Chain Data Dashboard. In this dashboard, we collected the data that is available publicly in the internet, and we linked everything at the drug level. Primarily, we rely on FDA data. That is the agency that really has purview on our pharmaceutical supply. But the FDA alone cannot link this data or really update it in real time, their own information. So that's really the groundwork that we did. Here's a snapshot of our data dashboard. Here's another snapshot in the middle of publications we have made. We have several papers in this year and a half that we've been working on this, including high-impact journals. And in October 2025, this is the FDA Commissioner, Marty Makary, was speaking in our workshop that we have conducted together with the national academies to disseminate this work. But the work is just starting. We just created this tool. Now we have an advocacy plan to really disseminate. Now that we have the foundation of our house built, how do we make sure it really grows and it thrives into the right audience and the data gets to the right hands? So first of all, we want to expand dissemination. We want to talk more to the media, have a strong toolkit to disseminate this tool. It's publicly available. It is very comprehensive. Secondly, we want to engage closer with the federal administration. Fortunately, our event happened during the shutdown and many workers could not attend. And finally, but perhaps more importantly, we want to develop a mobile application to really take this data that we have collected and put it on the hands of providers and patients. We believe in a ripple effect where policymakers can use this information to make more informed decisions, where they don't need to spend $100,000 every time they need answers. We want hospitals to have better information to guide purchasing decisions. Today, all that the hospital knows is how much a drug costs. If they want to buy a more expensive drug, how do they even justify that? Well, if they look up our dashboard and see that this more expensive drug never had a shortage, the manufacturer never had an FDA warning or a citation, then they can justify paying more for quality. Prescribers and consumers can have the information in the palm of their hand. We know, for example, consumers feeling that their drug is not working as well as the one they got last month. Now they can see, they can track by the NDC code where it's made, what was the track record of quality. And our measures of success are the web traffic on our platform, the app download and use that we will have, engagement and consultations with policymakers. Ultimately, our vision is to be a really trusted go-to source for data and for impartial evidence, that policymakers and the broader community that really cares about shortages in access to pharmaceuticals, they can come to us and trust us as a source of information and engagement in finding solutions for improving our pharmaceutical supply. Thank you so much.
Okay, nice job. Thank you, Mariana. We will take some questions from our judges now.
Thank you so much, Dr. Socal, for your presentation. My question today is, why do we have such little insight into the sources of our pharmaceutical supply here in the US?
Thank you for that question. That's an unfortunate reality, primarily because manufacturing locations and commercial entities, these are all considered what is called trade secrets. The FDA is very protective because manufacturers share that information. And so the FDA, as a federal agency, is very protective of that information. Now, like I said, commercial entities have full insight. And so this creates a real barrier in who has access to the data. And we want to shatter that barrier, especially to the end consumer, providers, and so on.
Time for one more.
Thank you. Such a great presentation. My question is, what policies or initiatives could make a positive impact to strengthen the U.S. drug supply?
Thank you for this question. So there's a lot of discussion, for example, about Made in America. And we agree that some strategic drugs should be made in America because there are drugs that we cannot live without. For example, antibiotics. There's no facility that is capable of producing penicillin in the US. And we don't want to depend primarily in China and have, in the event of a conflict, not have supply of a basic antibiotic. Now, we cannot do everything here. And so that's an important question about using data to identify which drugs we are really benefiting from continuing to buy from the global market, which drugs we should make here, and using quality indicators to guide our purchases so that we can use almost like a market-based solution to improving the supply chain in the long run.
Thank you, Mariana. That was great. Thank you. Next up, we have Harry Barbee. Harry Barbee is an assistant professor in the Department of Health, Behavior, and Society. Harry will be presenting on building a future for LGBTQ plus health. Harry finds that across the country, discriminatory policies are harming LGBTQ plus health, not because of a lack of evidence, but because of a lack of infrastructure to mobilize it. Harry is proposing the development of an LGBTQ plus public health advocacy lab that will bridge research and advocacy to ensure that evidence guides policy, protects care, and supports LGBTQ plus people in living with dignity and joy. Welcome, Harry.
Across the United States, LGBTQ plus health is being threatened by public policies that lack evidence. And that is generating preventable harm. My work asks a simple but urgent question. How do we ensure that evidence, not ideology, drives the policies shaping LGBTQ+ lives? My answer to that question, and what I propose to you today, is the development of an LGBTQ+ public health advocacy lab here at Johns Hopkins University. This year alone, over 600 anti-LGBTQ+ bills have been proposed, and 71 have been enacted into law. Bans on gender-affirming care have cut off access to life-saving treatment. School censorship policies have led to an increase in bullying, social isolation, and mental health problems among LGBTQ+ students. And we know this from the research. Hostile policy environments create measurable, damaging health outcomes. In other words, policy is a social determinant of health. But right now, our response as researchers is not keeping pace with these damaging policies. But there is a critical window for action. Court cases challenging anti-LGBTQ+ policies are advancing toward the Supreme Court, which means that evidence has the opportunity to shape national precedent. Sanctuary states, shown in green, are demonstrating that policies which protect LGBTQ+ people are not only effective, but they are politically viable. And a majority of Americans, in fact, 75%, support non-discrimination protections for LGBTQ+ people. So, the public is persuadable, the evidence is strong, and the momentum is here. But what we so often lack in academia is the infrastructure that bridges research, policy, and community. The lab that I'm proposing helps to fill that gap. My career has been about building that bridge between research and social change. I've published over 25 articles in top journals on LGBTQ+ health, including work on social determinants, aging, and access to care. I'm also a public member of the Washington, D.C. Board of Medicine, where I see how regulation affects healthcare. As a policy outreach fellow working with the Office of Senator Elizabeth Warren, I translate science into legislative strategy. I also engage publicly through award-winning national reports and media scholarship to ensure that evidence reaches not just academic audiences, but also the public. In sharing this background, I want to demonstrate that the lab I'm proposing to you is not a new direction for me. It is a strategic extension of work that is already in motion. And so, with the support of this award, I want to launch the LGBTQ+ Public Health Advocacy Lab with 3 clear, feasible actions in year 1. First, build a lab infrastructure and establish a 3-year strategic agenda with faculty, students, and community partners. Second, produce and disseminate policy briefs paired with targeted media and legislative outreach. And third, launch an annual policy convening, a 1-day strategic summit bringing policymakers, researchers, and advocates in shared conversation. These steps are achievable and coordinated, and they will demonstrate proof of concept and momentum. I hope to demonstrate impact with the following outcomes. First, in year 1, a functioning lab, policy briefs that are reaching policymakers and the public, and a successful first policy convening. In years 2 and 3, an expanded convening, briefs cited and policy campaigns and hearings, a strong mentorship pipeline for students and trainees, and collaborative papers and grants. By year 5, I want Hopkins to be a national leader in LGBTQ+ health research, advocacy, and policy translation. My long-term goal is simple: to make LGBTQ+ health equity more durable and systematically supported. At its heart, this work is about possibility. LGBTQ+ people deserve a future filled with joy and dignity. They deserve health care that is safe, affirming, and grounded in evidence. The LGBTQ+ Public Health Advocacy Lab can help support that future right here at Johns Hopkins University. And the Sommer Klag Advocacy Impact Award would turn that future into action, ensuring that Johns Hopkins leads not only in scientific discovery, but in defending the conditions that allow people to thrive. Thank you very much.
Thank you, Harry. That was great. We have time for 2 questions from our judges.
Harry, thank you for a compelling presentation. I am curious, what distinguishes this lab from other LGBTQ+ efforts?
Thank you. Yes, so there is a lot of work being done to support LGBTQ+ populations, but there's often a rift between advocacy work and research. I want this lab to be the bridge that connects those 2 areas. So I want to use research as a tool to inform policy, to inform interventions that allow LGBTQ+ populations to live happier and healthier lives.
Thanks for that response, Harry, and thanks so much for your presentation. You started by noting that you were bridging the gaps between research, policy, and community. Can you say more about how community partners would be included in shaping the priorities of the lab?
Thank you. There are many community organizations that are doing critical work for LGBTQ+ populations, especially critical in a political moment like this. Community organizations have the tools that researchers don't always have, but researchers have tools that community groups don't always have. So I want to partner with community organizations such that we help them meet their needs, but that they help us meet our needs. So I believe that community organizations can be critical partners for this lab to, again, create healthier lives for LGBTQ+ people. Thank you.
We're actually going to have time for one more question. Harry was under time on his presentation, so if we could get one more question from our judges.
Harry, where do you see the greatest near-term opportunity for impact?
Right. So right now, at a federal level, LGBTQ+ people are facing a very difficult political landscape. With that said, I think right now is a moment to act locally. There are many community organizations that are doing important work, but there are also many policymakers at the local level who are really interested in enacting policies that support LGBTQ+ people. Certainly right here in Baltimore, Maryland has been a leading state in supporting transgender healthcare, for example. I'm a resident of DC, where the city council is extremely supportive of LGBTQ+ people. So this is a really important moment to act locally right now.
Thank you, Harry.
Thank you.
That was great. Thank you to our first 3 presenters. We're going to take a little commercial break, and we're going to hear from one of our inaugural impact winners, Nadia Axier.
Hi, everyone. I hope you're enjoying the pitch presentation so far. I'm Nadia Axier, an associate scientist in the Department of International Health and one of the inaugural winners of the Sommer Klag Advocacy Impact Awards. Earning this award in 2023 has allowed me to do a series of activities for Afghanistan that I'm very, very excited about, and I will highlight just a couple here for you today. One, I've been able to establish a partnership with UNICEF Afghanistan and key Afghanistan donors to design and implement a mixed methods implementation research study to understand how to best provide multiple micronutrient supplements to pregnant women in Afghanistan. This is the first of its kind of study for the country, and I'm really excited about the data we're going to collect and the potential impact it's going to have to optimize the MMS program in Afghanistan. I've also been able to work with the World Bank to evaluate Afghanistan's health sector strategy for 2023 to 2025. And this exercise has provided some of the foundational data for the strategy refresh for 2026 to 2028. And finally, I've engaged with several of Afghanistan's long-term donors, including the World Bank and European Union, and program implementers such as WHO and UNICEF, to continue providing funding and programmatic support for Afghanistan into 2030. We know in this day and age, with limited funding for global health, it's very, very important to continue to do advocacy for those contexts and needs, such as Afghanistan. I'm very excited to hear more lightning pitches from my fellow Bloomberg School faculty. And to those tuning in, enjoy the rest of the competition. And to the finalists, good luck and congratulations.
Okay, welcome back. Thank you, Nadia. It's really exciting to hear about the exciting progress that you've been making since our last Impact Award process. Up next, we have Rebecca Kritzer. Rebecca Kritzer is an assistant practice professor in the Department of Environmental Health and Engineering. Rebecca will be presenting on state model laws to enhance animal welfare. Lots of animals today. Rebecca believes the time is right for the scientific community to embrace new approach methodologies as critical tools that can close the data gap left by animal models. However, this transition will not be successful without the support of our legal and political systems. For this reason, Rebecca proposes the creation and adoption of a state model law that will encourage states to take an active role in both elevating laboratory animal welfare as well as encouraging the development and implementation of new approach methodologies to ensure the availability of the best data to promote public health. Welcome, Rebecca.
Thank you. Oh, there I am. Hi, I'm Rebecca Kritzer. Thank you for that introduction. I'm an assistant practice professor with the Toxicology Policy Program, and I'm thrilled and honored to be here today to present my advocacy pitch for a state model law that does two things. One, it promotes new approach methodologies, and two, it provides for enhanced laboratory animal welfare. So let's unpack that a little bit. Animal models are the gold standard in research and testing. At least this is what we have been told. This is what our legal institutions, which support our scientific programs, assumes to be true. But animal models are imperfect. I think we can all agree they are imperfect. They have left gaps in our data and understanding. And those gaps have resulted in waste, financial waste, material waste, animal waste, and time waste. Many of us are familiar with the statistic that 90% of drugs that clear preclinical, the animal data-driven phase of trials, ultimately fail when they move to human clinical trials. Unfortunately, this results in a delay in drug development, drug approval, and most importantly, access to life-saving drugs. And also, as I show you up here, this is one of over 4,000 so-called Envigo beagles. Envigo was a dog breeding facility for research use that was shut down recently. And over the past 2 years, these dogs have been rehomed. Envigo was shut down as a byproduct or as a result of egregious animal welfare violations. And so this gap is also responsible for unnecessary animal suffering. So what do? What's the next step? How do we move forward? Well, thankfully, we have what are called NAMs, or New Approach Methodologies. And you can think of NAMs as a toolbox. And there are numerous tools in this toolbox that range from human cell cultures to computational models to things like organs on a chip. And these NAMs will provide us with human relevant data that can fill this gap. But we need the legal infrastructure in place in order to support this transition. Fortunately, we have seen progress on this front. Just this year, 16 bills were introduced in Congress to address this gap. But as we know, the federal government can be prone to shifts in policies and priorities with the changes in administrations. And so this is why states have a vital role to play in supporting the development and implementation of NAMs. Once again, I have some good news on this front. States have already begun this work. Just this year alone, 35 bills have been introduced across all 50 states to address this gap. The problem is the state efforts have been fairly patchwork in nature. Therefore, what we've done with the Toxicology Policy Program is undertaken a systematic review. And this review includes both the bills that have been introduced as well as state laws that have been enacted on this front. And we have assessed these laws to identify key provisions and draft a state model law that will promote new approach methodologies and enhance laboratory animal welfare. You can see the team pictured here on the left. We are a group of interdisciplinary folks comprised of both legal and scientific experts. And on the right, you can see our draft compendium of our review that we have undertaken. It is my hope that we can continue this work by advocating for the implementation of this model law. You see here a 3-step plan. The first, and I would say critical step, is to engage with key stakeholders. Now, these key stakeholders are going to be folks involved at the policy decision levels, at the state levels, but also those who are impacted by these laws. So those who are in the lab, those who are doing the research, those who we are asking to make this transition, as well as those who are working on developing the NAMs to be used in the transition itself. This first step will also serve to elevate the understanding of this topic in the minds of those individuals who will be key players in steps 2 and 3. Steps 2 and 3 are less rigid than they might seem on this slide. The first is the adoption of the model law in a compendium. This serves to, again, elevate the model law in the view of the minds of the states. But it is a long process, and so we will simultaneously be working to have the law adopted by the states themselves. Ultimately, the goal here is better data and better welfare for animals. There are over 100 million animals used in research and testing in the United States alone every single year. The majority of those animals are mice and rats bred for research purposes. And unfortunately, because of that, they are not covered by governmental oversight under the Animal Welfare Act. At the same time, animal models have and continue to provide us valuable data about safety, among other things. And I do not wish to conflate ethics and efficacy. However, with both the federal and state level governments working together to provide a legal infrastructure that supports this transition, we can work towards a better public health advocacy through a new golden model, a new golden standard, sorry about that, a new golden standard, which is human relevant data provided by new approach methodologies. I'm Rebecca Kreitzer. This has been my pitch for a state model law that promotes NAMs and enhanced laboratory animal welfare. I thank you for your time and attention.
Thank you, Rebecca. Nice job. We'll take questions from our judges.
So Rebecca, what connections have you developed beyond those of your team that makes you particularly well suited to pursue this work to make this impact?
Thank you for that question. So I could probably answer in a couple of different ways. What I'd like to focus on is my role in the American Bar Association, which is the largest voluntary professional organization in the world. It is comprised of both sections, and under the sections are committees. And I'm an active leader in the Animal Law Committee, which is part of the TIPS section. I co-chair the Science and Technology Subcommittee, as well as their Policy and Alliances Committee. And I have seen this role as critical in networking efforts. I will also note that the American Bar Association, just last year in 2024, passed a resolution promoting that government at all levels support the promotion and implementation of NAMs.
For your presentation, Rebecca, and thank you for that answer. My question for you today is, have you thought about which state you would pursue first, and what criteria did you use to make this determination?
Great question. So I don't have a direct answer for the first question, because part of it will depend on the political landscape, which we all know is shifting on a regular basis. But I would love to speak about some of the criteria. Thankfully, this is a bipartisan issue. Mostly that's a good thing. The only downside is it doesn't allow us to narrow in at all on what states we might pick. What we would look at, however, is probably a state that doesn't already have pre-existing legislation so that we're not competing with current efforts. We're going in with a clean slate. We also need to find an advocate, our champion. And we're going to also look for folks on the ground who can help us raise the grassroots efforts.
I think we'll take one more question.
I'm going
At a time.
to follow up a little bit on what you were just talking about. Do you foresee any concerns that states will be preempted or otherwise barred by the federal government from legislation in this space?
Thank you so much. I love that question because there's a lot of concern around that. There's a 40-plus-year-old case that gives some people some pause, actually based out of Maryland. It's called the Taub case, if anyone's interested in looking it up. But the short answer is no, I'm not worried at all. So that case is generally believed to have been misconceived, misunderstood. Doesn't suggest that the states are preempted. Those with the legal background will know that preemption is a multi-step analysis. You start with doing sort of an explicit analysis. Does the federal government say, states, get out of here, you're not welcome? That's not the case at all here. Then you move to an implicit sort of, they haven't said it, but do they kind of mean it? We also don't see that here. In fact, the Animal Welfare Act explicitly invites states to operate in this space. And then finally, you have to look at what's called direct conflict preemption. And there, that's really a drafting issue. And so we've made conscious efforts to draft this model law in ways that would avoid potential conflicts. Thank you.
Perfect. Thank you, Rebecca. Last but not least, we have our final presenter, Rose Weeks. Rose Weeks is a senior research associate in the Department of International Health. Rose will be presenting on protecting children's health through vaccine advocacy. The success of U.S. vaccine programs which protect healthy children is under threat more so than in any time in recent decades. Rose will discuss a new advocacy strategy led out of the International Vaccine Access Center to strengthen the work of state immunization coalitions using data and tailored state resources. Welcome, Rose.
Thank you so much for the opportunity to be here today. Thank you to the judges. Thanks very much for the introduction, Diane. Oh, that's not what I wanted to do. Sorry.
Okay, we'll get this sorted.
Right, sorry about that. Okay, great. Thank you so much. The issue of ensuring vaccine access is very personal to me. I have a son named Franklin who has asthma and has been hospitalized with respiratory distress. I can choose to get my children vaccinated against preventable disease, but if others do not do so, it puts my family at risk. I believe that we should have strong immunization policies so that no family suffers from having a child hospitalized with a preventable disease. Unfortunately, in the past few years, we've seen an avalanche of anti-science bills hitting state houses across the country that are threatening to strip away protections that we've built over a century for public health. I've actually counted over 170 bills that have been proposed at the state level that would weaken childhood immunization programs. And most of these would roll back, weaken, or completely eliminate the requirement that a child gets vaccinated before starting school. This anti-science lobby is just getting started. They have $63 million to spend annually on this effort, and we expect, as a result, that we'll see no fewer than 800 bills introduced in 2026 at the state level that are focusing on childhood vaccine programs. We know that this has an impact. When it's easier to get a vaccine exemption, we see lower rates of vaccine coverage. We see greater rates of disease transmission. I can also tell you what this looks like at the individual level. Our scientists have measured that when a parent opts for an exemption and doesn't get the measles vaccine, the child is at a 22 times higher risk of getting measles. This is obviously not what we want. We also see measles and whooping cases surging in 2025, more cases in 2025 than any year in the past 30 years of measles. And over 40 children hospitalized with measles, an entirely preventable disease with a vaccine that's almost 100% effective for life. As you can see, children's health is really poised at the precipice. My team at the International Vaccine Access Center is working to fight back. We see a threefold opportunity. First, we'll quantify the threat. Second, we'll inform policymakers. And third, we will support coalitions working at the state level. Under quantify the threat, we are summarizing national trends when it comes to vaccination exemptions and other types of policies implemented by the state. And we're connecting that with the staggering costs of a vaccine-preventable disease outbreak. We're also informing policymakers through a series of new policy briefs that have just launched in September that have 7 key indicators summarizing policies and practices in each state that affect vaccine uptake. So that's one tailored brief for each state and the District of Columbia. In support coalitions, we hope that these monthly updated briefs provide the ammunition that immunization coalitions need to counter these well-funded activities of the anti-science lobby that now have operations in every state. So we'll support them through direct partnerships with these frontline advocates who oftentimes, sadly, have lost a lot of their federal funding and staff, but remain doggedly determined to protect children's health through committed volunteer efforts. We've been laying the groundwork over the past few months to support these efforts. Since we launched the briefs in September, we've presented them on national calls with other stakeholders, and we've also done a lot of talking to coalition leaders who know this issue so well. We've met in person with coalition leaders from 6 states. You can see them on the map. And we've had some very interesting discussions. Here are these preliminary learnings from those discussions. In Arizona, we've heard that coalition leaders have actually documented declining access to vaccines for children providers. This is the critical program in the United States that provides 1 in 2 vaccines, vaccines for 1 in 2 children across the U.S. So this is a really critical factor why we see declining coverage in Arizona and probably in other states also. In Kansas, we've heard of something called grab and gut bills. Grab and gut bills are when a bill is replaced in its entirety just before becoming law. And this is done in close consultation with the anti-science lobby, who contact lawmakers on a daily basis about these issues. This really threatens health in a state like Kansas that has strong family-centered vaccine traditions. Meanwhile, in Louisiana, health departments are now prohibited from conducting vaccine outreach to communities. However, in Louisiana, as in these other states, we see some of the strongest and most effective coalition leaders working doggedly to preserve access to these programs. Our action plan is threefold. We will track bills, we will increase our national reach, as well as the issue visibility, and finally, we will study policy implementation. Under tracking bills, we do expect to see at least 800 bills introduced between January and March of 2026, and we'll be working to track them and understand how they interact with existing state policies, as well as federal changes that are happening quite quickly. I'll be engaging very closely with the state immunization leaders, the coalition leaders rather, to understand the true intent of the bills, because oftentimes they're written in a way that's purposely vague to hide their true intent. Secondly, we will double the number of national organizations we're engaging with from 6 to 12 organizations, and we will also work with our local coalition leaders to co-author op-eds for local newspapers using culturally framed messages that emphasize family, convenience, and tradition. We know that convenience is a real powerful theme that resonates in politically diverse places. Third, I will lead an analysis of policy implementation, what that looks like from state to state, how to enable parental choice while ensuring appropriate friction. So it's not easier to get a vaccine exemption than it is to get a vaccine. How policies are put into practice is of particular interest to me as a doctoral student studying implementation science. And this analysis will focus on school nurses as a key implementer of these policies. Oops. Our impact is, as such, protect our public health programs so babies thrive into childhood, adolescence, and adulthood. We'll measure this effort through 4 key means. First, I will assess the effectiveness of the brief format and the bill tracking service using interviews with coalition leaders. Second, I will create an enabling environment for effective vaccine policy by publishing op-eds in key media markets. This creates a news ecosystem that is favorable to positive vaccine uptake bills that support vaccine uptake and just generally positive for vaccine uptake for the community. This creates a very favorable environment so that the coalitions can be really empowered to defeat these harmful bills. And third, I will build strong relationships with grassroots advocates in politically diverse states. And fourth, I will really work to understand the policy landscape here and how the bills are getting implemented by school nurses and others at the school level. Thank you very much for your consideration, and I look forward to discussing this issue more with the judges.
Thank you, Rose. Our judges, do we have any questions?
Rose, thank you for your presentation. You talked about in your action plan studying the implementation of exemptions, and I'm curious, do you believe states should eliminate non-medical exemptions to vaccination, i.e. not allowing for religious exemptions?
Yeah, so that's a very complicated question. And I thank you for raising that. There are many things you can say from a bioethical perspective about the role of mandates vis-a-vis immunization programs. I really look at this from a practical perspective. In all but a handful of states, really just 4 states, the mandates are really just a default. It's really a presumptive approach to immunization that really ensures there is an interaction between a family and a care provider that ensures children get the most important preventive care services before they start school. It is a choice that parents make, and there is an opt-out lane for them. We do think it should be a little bit not as easy to get an exemption as to get a vaccine because we want to reinforce that immunization is very important. And so that's sort of the perspective that we take, but we know that easier it is to get an exemption, like definitely you have lower coverage, higher rates of disease transmission, and ultimately you do see these outbreaks happening.
Yeah, thank you so much for that response. So my last question for you today is, could you tell me more about the role of immunization coalitions in the states, and how do they garner trust from communities, and what makes them effective messengers for the benefits of vaccines?
Yeah, immunization coalitions are, this was really exciting to us to learn about this role recently. We've been getting to know these folks, and they have such a strong role in building trust and connecting stakeholders across their states. They connect the agencies, the health agencies that are delivering a lot of health services, and they also work with providers as well as parent groups, and they look at where the access gaps are. So like where we saw in Arizona, where the Arizona Immunization Coalition was able to identify that there was declining access in key jurisdictions and then work with partners to mobilize resources to close those gaps and make it easier to enroll in vaccines for children and other actions they're taking. So they're very much at the grassroots, but also looking at the big picture and bringing together folks to close access gaps. So we're really excited to have the opportunity to work with them more in this project.
Perfect. Thank you, Rose.
Thank you.
Okay, that was our final presentation. So big thank you to all our faculty presenters. Thank you so much for sharing your work with us. We're so grateful for the time and preparation that all of you have put into this. And it's really wonderful that you could share this with our community and maybe even some friends and family online if they're watching. So thank you. Really excellent presentations. Very, very fascinating. So now it's time for the audience to vote. So we have about 2 minutes for voting. So if you could scan your QR code, follow the screen instructions for voting, and our judges are going to work on their final scoring sheets. And while you're voting, some of you will be faster than others. So while you're voting, we're going to hear remarks from our other Advocacy Impact Award winner from our last round of awards, Cass Krafasi.
Hello, everyone, and thanks for tuning into this incredible advocacy event. I'm Cass Krafasi, an associate professor in the Department of Health Policy and Management, co-executive director of the Center for Gun Violence Solutions, and one of the inaugural winners of the Sommer Klag Advocacy Impact Awards. Earning this award in 2023 allowed me to support efforts to pass firearm purchaser licensing laws in Delaware and Washington. I was able to work directly with partners in a way that was rapid and flexible to translate research into action. Both Delaware and Washington signed bills into law, and my team is eager to support their implementation efforts. Today has been full of incredible pitches. It's truly awesome to see my colleagues engaged in such meaningful advocacy work. Congrats to today's finalists and winners.
Okay, welcome back. Thank you for all your votes and your patience while we tally up the votes. This is very exciting. Everybody's very excited and maybe a little nervous. I'm going to pass it over to two of our judges, Vanya Jones and Michelle Spencer, and they are going to announce our two winners. And each of our winners will receive an award, and our other finalists. Congratulations to everybody. Everybody did an excellent job.
Hardest part of the job. This is so exciting, and the energy in this room is so great, and your pitches were amazing. But I have the privilege of announcing the first, is it winner? Is this the word I'm using? Winner of the Advocacy Impact Awards. And the first winner is Dr. Harry Barbee from Evidence to Action, Building a Future for LGBTQ+ Health.
Congratulations to all of you, and to you, Dr. Barbee. I have the privilege of announcing our second Advocacy Impact Award winner, and that goes to Dr. Mariana Socal, for Associate Professor in the Department of Health Policy and Management on protecting the U.S. pharmaceutical supply through data and evidence. Congratulations. Of course. So, absolutely.
Great. Yeah, we're going to have some remarks from each of our winners.
Thank you so much for this award, judges, and to the audience. This award affirms that advocacy is not separate from science. It's actually how science fulfills its promise. Today, I propose the LGBTQ+ Public Health Advocacy Lab, which is about transforming evidence into action and ensuring that care, dignity, and joy are possible for everyone. I'm deeply grateful to my mentors and my collaborators and community partners who have make this work real, and to the Sommer Klag Award for recognizing that advancing health equity is advancing public health. Thank you.
Well, first of all, thank you so much again to the Lerner Center. This was amazing and so inspiring to hear from everyone and witness, the richness of all that we have to offer here at Hopkins. I have two key thank yous to say. The first one is to the Johns Hopkins Nexus Research Award. It really enabled us to pursue a crazy idea to put together data and mine the internet and do something that was not done before and really put it out there into the public domain. And we believe that this was really important to enable some disruption. We want to implement change and catalyze change and bring in disruption to a market that, can benefit from transparency. So I really appreciate today, as well as the Nexus Award, from having our support internally as well. And second, but not less importantly, I really wanted to thank my team. Like I said, we're a big team of faculty. We're working together, and I believe we're bringing the best that Hopkins has to offer. And by doing so, we're really upholding our mission, of transforming and saving lives, millions at a time. Here, we're doing it through data and evidence. And I really appreciate the contribution of every single person in the team. We bring in different skill sets, and I'm very proud of being part of a team like that. So thank you so much.
So my phone has been blowing up with texts of cheering since the crowds weren't allowed in here with all the logistics. I hope you could truly feel all the love and support. And maybe, Mariana, to build off of what you were just saying, advocacy is a team sport. It takes a community. I cannot thank all of our judges enough for being part of our community. All of you, the reason I wasn't allowed to be a judge is that I did vote for all of you, and you are all winners. There's a reason you're holding a plaque, because the work you're doing, whether you're walking home with a $40,000 check or not, the work you're doing is making a difference, and you are inspiring our field, our academy, that what you are doing is exactly what's needed. And Harry, thank you. You bridged that by noting our research, if it's not built in and getting out into the hands of people who are making decisions about our lives, our communities, our families, then it's lost. So all of you, thank you so much for what you're doing. Be part of our community. Join and engage with the Lerner Center. It's really simple, Lerner Center at Johns Hopkins. We'll find you. Also, please stay engaged. Keep this spirit, keep this heart. Thank you, Lerner Center team, for a beautiful event. And let's keep this team sport happening. The championship is not over. Thank you.